Hi, I'm Ceana,
I'm Jaedyn.
and our muscle is the semitendinosus. So the origin of the semitendinosus is on the ischial tuberosity, and the insertion is the superior medial condyle of the tibia. And then the origin of the semimembranosus is the ischial tuberosity, and the insertion is the posterior surface of the medial condyle of the tibia.
The concentric action, which is muscle shortening, of the semitendinosus accelerates knee flexion, hip extension, and internal rotation. Knee flexion is when the knee bends and the angle between your shin and your thigh decreases, like during the downward motion of a squat. Hip extension is when the leg moves backwards or the body moves upright from a bent position, like standing up from a squat. And tibial internal rotation is when the lower part of your leg twists inward towards the body, and this happens when performing a squat or even when just walking.
So the integrated eccentric action decelerates the knee, prevents hyperextension, and causes tibial internal rotation. So the eccentric action is point A, point A is the starting bent position, and then point B is the eccentric action. So an example is while walking, the eccentric action would be the leg swinging forward just before striking the ground, and the semitendinosus is acting as a decelerator to prevent hyperextension of the knee, and the semitendinosus also causes tibial internal rotation when the knee is flexed.
The integrated isometric action, which is when the force produced by the muscle is equal to the force on the muscle, so there's no movement happening. The semitendinosus does an isometric action to stabilize the knee when it needs control rather than movement, and it controls rotational and lateral forces to prevent excessive twisting or sideways movement, and it also helps to protect the meniscus and the knee ligaments.
So the antagonists of the semitendinosus, the semitendinosus is a prime mover in knee flexion and hip extension. So the antagonists would consist of muscles that complete the opposite action. Muscles that extend the knee would be the antagonists of the semitendinosus. So the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. And then muscles that extend the hip would also be antagonists. So the iliopsoas, rectus femoris, TFL, sartorius, and pectineus. And these are considered to be antagonists because they complete the opposite motion, which is extension. So in order for the agonist to move properly, the antagonist muscle must be at rest or in the lengthening position.
To measure extensibility of the semitendinosus, there's two different tests that you can do: the knee extension test and the straight leg test. For the knee extension, the patient is lying on their back with the hip bent to 90 degrees. Then the knee is straightened either by the patient or the examiner, and this helps to see how flexible the hamstrings are and how much range of motion is in the hip. And in the straight leg raise test, the patient is also lying on their back, but the legs stay straight, and the examiner lifts the leg up, and this also looks at hamstring flexibility and the range of motion in the hip.
So MMT testing is adding the force in an opposite direction that the muscle performs. The client would lie prone with the knee flexed to about 50 to 70 degrees, and then the knee would be internally rotated to the tibia while stabilizing the bicep femoris. So pressure should be applied into knee extension. And this is just like a video example.
Some isolated exercise to lengthen or stretch the semitendinosus. You could do a banded supine hamstring stretch. which is done on your back using a band around your foot to lift up your leg and keeping it straight until you feel a stretch in the back of your thigh. And you just use the band to help you control the stretch and go a little farther without forcing anything. And the NMS hamstring complex is very similar, pretty much the same thing, just without a band and with a practitioner. And in this one, the practitioner lifts and stretches the leg for the patient, and it allows for the practitioner to control the stretch and check the hamstring for range of motion.
So an isolated exercise that activates the muscle would be the Nordic hamstring curl. It's an eccentric motion which activates the semitendinosus, and the resistance comes from your own body weight.
Nordic hamstring curl.
Towards the ground,
the Nordic hamstring curl involves kneeling on a pad and lowering under control while the ankles are held in place by a partner.
From muscle in motion.
Nordic hamstring curl. The Nordic hamstring curl involves
some functional activities of the semitendinosus. In sports, it's used a lot during movements that involve sprinting and quick changes that bend the knee and extend the hip. So it's active when a basketball player goes up for a rebound, or even when they're shooting the ball, or when a soccer player kicks the ball to go for a goal. It also helps with walking, running, and jumping by stabilizing the knee and controlling the leg movements.
So a potential injury is just like commonly tearing or straining the semitendinosus. There are multiple grades for the strain, 1, 2, or 3, and it's commonly caused by overuse or like just a direct incident in a sport or workout that caused the strain immediately. And then here are our 2 test questions, and then our references. Thanks.